It is Colon Cancer Awareness Month, and tonight we're going to take a moment, just kind of sit down and talk a little bit with a doctor to give you some simple information on why it should matter to you. The CDC says colon cancer is among the top 5 cancers when it comes to new cancer cases. National Cancer Institute has said that cases of colon cancer have been increasing, especially in people under the age of 50. Tonight we are joined by Dr. Carol Nwelue with Baylor Scott White out of Fort Worth for you, where you practice. Let's talk simple things first. Symptomatically, what are we looking for outwardly if we suspect colon cancer?
So could be changes in your bowel patterns. Some people that may be diarrhea, for others it may be more constipation, some abdominal pain, not feeling like yourself, and losing weight when you're not trying to.
Can I just jump in and say, let's be, I mean, it's uncomfortable to talk about those movements, but in reality, we can have that after we've eaten something weird, or, you know, so how do I know to delineate when, when I should call my doc and when, oh, I just had a bad meal?
Great question. So if you're noticing these symptoms for weeks, especially months.
So long term.
Absolutely.
Yeah. Let's talk about screening a little bit. Recommended to get a colonoscopy, and so I want to talk about that, but also want to ask about other screenings. But colonoscopy specifically, they lowered the age a while ago, right?
They did.
Was that a year ago, somewhere in that neighborhood?
Yes.
So down to 45. Why did they do that?
What we're seeing is an increase in colon cancer, as you said, in patients that are less than 50, and deaths in those patients. So we're really concerned about that. Want to get to it earlier.
Right. And at its purest form, colon cancer is something that can be very sneaky if you don't stay on top of it, right?
Yes.
Yeah.
Unfortunately, we see people who have had these symptoms for months, years, and not had them checked.
Didn't listen to their body, and next thing you know, you got a really bad diagnosis.
Yes.
That can be the part of the reality. Okay, so colonoscopy, one of them. I can tell you personally, I had one 2 weeks ago. It's not the worst thing in your whole wide world, right? You're going to stay close to the potty for the evening, and it's not as bad as a lot of people make it out to be, but it gives you peace of mind, which is the biggest thing.
Absolutely.
But okay, so I don't want a colonoscopy. What are the other opportunities to get checked?
Thankfully, there are others. There are lots of stool samples where we can look for signs of cancer, we can look for blood, and actually the New England Journal of Medicine just last week talked about a study that was done that shows we may be close to getting a blood test to determine whether people have cancer.
That would be interesting.
Yes.
Yeah, and they've made a lot of advances over the last 15, 20 years in how we can check. Is there anything we can do as a human being to just prevent this? Because I would think part is if your family has it, there's a genetic component for some, right?
Yes.
Because I know people who get them every other year or every year because family history, and they just naturally have polyps, and it happens for them.
Yes, that is very, very true. So we say at 45. For some people with a history, it may be less than that. But we really want people to avoid smoking, avoid alcohol use, especially excessive use. Watch your weight. We've seen that people are more likely to develop colon cancer if they have diabetes, smoking, drinking, and overweight. And the big one now these days is diet and eating processed meats and lots of red meat. And
in reality, so much in our world is processed anyway, right?
Unfortunately.
It's a job in and of itself just to eat the right way, for all of us. Doc, can't thank you enough. That's really great information. It's good, and it's basic information that you can take and you can use. And if you have any questions, ask your doctor, right?
Yes.
Talk to your doctor.
Absolutely. That's what we're here for.
That's right. Doctor, thank you for being here.
No problem.
We appreciate your time as always.